And more African Americans are getting inoculated against COVID-19. The Kaiser Family Foundation says a roughly equal share of Black, white, and Hispanic adults had received at least one vaccine dose by late September. Researchers say a wave of employer mandates, pro-vaccine campaigns, and a surge of deaths from the Delta variant have all narrowed the racial disparity gap. Officials say vaccines are more easily available in Black communities, but more work still needs to be done. Many historians say grim reminders of events such as the Tuskegee experiment have discouraged many Black Americans from getting the shot. That 40-year study led to advancements in penicillin after it examined untreated cases of syphilis in hundreds of African-American men in Tuskegee, Alabama, withholding treatments available to those men. Black community advocates say it is just one of many stained chapters of American history that eroded trust in the medical community. Many hope COVID vaccine efforts can help rebuild it. For more on this, I want to bring in Dr. Oni Blackstock. She is the founder and executive director of Heath Justice. That is a health consultancy focused on reducing inequities in the communities it serves. Dr. Blackstock, welcome. It's great to have you with us. So African Americans were less likely to want to receive a shot of the COVID vaccine at the beginning of its rollout. Why are more getting a dose now? What has been sort of the evolution of the vaccine effort?
Well, thank you so much for having me on. I think it's likely multifactorial. We know that the Delta surge over the summer definitely got many folks more motivated to get the vaccine. Also, that surge resulted in a number of overcrowded hospitals, increasing in deaths, number of cases. That also, I think, motivated a number of folks who were not vaccinated to decide to get the vaccine. The Kaiser Family Foundation survey had found that more folks knew individuals who had been sick or died from COVID-19. That was also a motivator. And then lastly, not necessarily employer mandates, but mandates around sort of going to the gym and needing to be vaccinated, going to concerts, sports events. Those also increased people's willingness to get vaccinated. And in particular for Black Americans, as access increased in Black communities, and we saw pop-up clinics, mobile clinics, we saw different incentives that were provided for vaccination, all of this being delivered by trusted messengers, that was also very key to increasing vaccination uptake in Black communities.
And how has vaccine misinformation impacted Black communities specifically? And what are some of the disparities that you see between rural and urban areas?
No, that's such an important question. So we know that there are targeted COVID-19 misinformation campaigns that are happening. There have been the disinformation dozen who have been identified, and some of those entities are actually targeting Black communities with misinformation, such as Robert Kennedy Jr. We know there are entities and actors in Russia that are also deliberately reaching out to and targeting Black communities to heighten concerns around getting the vaccination. And so we really need to be able to counter those efforts, and countering those efforts is having individuals from the community, faith leaders, other leaders in the community who are respected, having them speak out and really correct this misinformation that we find, all over the place, especially on social media.
So what can now be some of the reasons that people are still not getting vaccinated? And what is your message to those holdouts?
Right. So I think, for some folks, for a tiny proportion, access still continues to be an issue. So I think given that we're also going to be rolling out boosters, we still need to make sure that vaccines are accessible to all Americans. I think also there are going to be a proportion of the population that is going to remain resistant to vaccination, and hopefully measures such as employer mandates will help to increase those numbers. And then also having folks just from those communities where we see low vaccination rates, have those folks, people who support vaccination, speak with their fellow community residents, their neighbors, about why it's important to get the vaccine. We know the messenger matters, and so for these communities that have high rates of no vaccination, we know that that's also incredibly important. We know that fear and shaming folks is not going to be helpful, and it is not going to motivate people to get vaccinated. And we really need to understand, what matters to people, what is going to be that hook to get someone vaccinated.
Dr. Oni Blackstock, thank you so much for joining us. We appreciate your expertise.
Thank you so much.